We all know why everything that has to be cross-cutting comes to an end at the last. So there is future-proofing of whether it is community bases, which started, or anything that has to happen with health systems, there has to be a digital element to it today. And hence, we have future-proofing healthcare, digital strategies for resilience. The last but not the least session. And of course, after that, we have Sohail ji, who will actually sum up the 2 days. So in again, keeping in time to an essence, I'm going to invite Ms. Supriya Kotra Prabhakar, our technical head for Digital Health, Access Health International, who is going to moderate the session and also going to bring out everybody's, participation to this session. Supriya, all yours.
Good afternoon, everyone. I'm Supriya Prabhakar. I work in the Digital Health Department of Access Health International. We've had an incredible 2 days of learning. We've had thought-provoking sessions and dynamic exchanges in these 2 days. As we move into the final session, we would like to turn our focus onto the future, on how we can future-proof healthcare through digital strategies for resilience. I'd like to thank Amazon Web Services for their support in this session and hope to have continued collaborations with AWS in the future. We'll commence with a set of presentations from 2 distinguished speakers. And this was going to be followed by a panel discussion on global perspectives on AI in healthcare. So it's my pleasure to introduce our first speaker, Dr. Karthik Adapa, who will be speaking about AI in healthcare, its applications, challenges, and ethical considerations. Dr. Karthik Adapa is a physician scientist at WHO CRO, previously serving as Secretary for Department of Health and Family Welfare in Punjab, India. His research centers on health information technology, leveraging human factors engineering, implementation science, and artificial intelligence, supported by his background in internal medicine, public health, public policy, and health informatics. He's an adjunct faculty member at Yale University and University of Carolina School of Medicine, North Carolina. Contributes to editorial boards of notable digital health journals like the Nature's Digital Medicine and JMIR. Dr. Karthik Adapa.
Good evening. This is by far the first time that I'm actually speaking to a very few audience when there is AI going on. So as AI moves into scalable evidence-based work around the world, probably this is the first time with so few participants, but I hope there are more participants outside. What I want to do is I want to take the next 10, 15 minutes to give you a snapshot of where is AI, especially in health, going around, and what do we really need to do as a global community to have AI for everyone? So what I will do is in the next, wow, that's, I guess, some technical issue here. So now this has been a very interesting year since AI is probably the first time in human mankind, one science or a scientific discipline essentially got 2 Nobel Prizes, one in chemistry and physics, of course, in physics for fundamental work, in chemistry for applied work. And therefore, this year has been a year where truly AI is been a transformational force. But AI is certainly not a new thing. You would see it about 35, 40 years back, 68 years back, when we had the first global session on AI. But the reason why AI is essentially emerged is that the global data is essentially doubling every 2 years. What you also see is a computational power that is actually doubling every 2 years. Added to that, the cost of training models is reducing by about 99% in the last 5 years. What you also see is an exponential growth of AI research, not just in health, but also in a variety of areas around. And then you see a lot of capital expenditure on AI. Now, if you just look into the top 3 big firms, Meta, Google, and Microsoft, those 3 alone in 2024, estimated cost of their estimated investment is about 152 billion US dollars. Now, as against that, you can see a lot of converging sciences, all essentially helping this explosion of AI. And then the computational power, essentially in terms of the hardware computing, is also grown tremendously, all to reach a stage where we believe that now in human mankind, as we've seen a variety of technologies, what is going to be very interesting is I'm hoping there are people, apart from the baby boomers, the millennials, one thing that has truly transformed is internet, but AI is supposed to have 3 times the impact of internet alone. Now, this being the scenario, what is going to be very important, therefore, is to see what is AI, how is AI impacting healthcare? Now, in AI, in healthcare, the biggest challenge is, while healthcare is an extremely difficult sector to implement AI, primarily because we contribute just about 5% of the global data on health. But there has been still an exponential acceleration of research in AI. And therefore, what you see is this big, broad use case journey across pharma, health systems, individual population health. And when you look at it across the care continuum, you would see a variety of applications. So if this is the use case journey, what I want to do is I want to just focus on a couple of examples on where there is more evidence, staying within these buckets of diagnosis, treatment, and follow-up. Now, certainly one of the first places where AI started making inroads is in diagnosis, and especially in radiology, whether it is a lung cancer, whether it's tuberculosis, where diabetic retinopathy. There have been a variety of studies that have demonstrated computer vision and vision image processing. But we also looked into breast cancer screening, whether it is mammography or now thermography. There's a lot of growing evidence in screening tools. You'd also see it in something like dermatology, where there is, again, imaging being used. You would see in digital pathology as well. Now, this is a very interesting question where radiologists essentially felt, are we really needed now, right? So radiologists had this survival existential question. And I really like what Curtis essentially talks about, saying it's potentially going to be radiologists who use AI tools are probably going to replace radiologists who don't use AI tools. Now, in treatment, you would see the growing importance of not just on the drug discovery, but also the AlphaFold is essentially making huge inroads. Now, in chronic disease treatment and follow-up, you have a large amount of studies that are showing a lot of evidence. So overall, what you would see is in the diagnosis, treatment, and follow-up, there is a variety of evidence that is emerging at different levels. But what is truly the science part is when studies like this come even in extremely revered journals like JAMA, where this study shows that something like an LLM has a potentially greater quality of response and greater empathy than even physicians. Now, I, as a physician, was extremely surprised at how is it possible that this flousy, flossy, flowery language that an LLM is something which patients perceive as empathy. Now, this is, of course, an extremely distressing paper. And of course, there are a lot of flaws in this. And we had to come up with a new paper in Lancet to show what essentially happened was when patients started asking questions, a physician, just because of the limited time that they have, they give more curt, direct replies, right? You really can't expect a physician to write, hey, how are you? And have a flowery language to explain. And that is essentially seen as a lot more empathy, because what the LLM has is it can automate and give you that very interesting empathetic responses. Now, you also see that in terms of in LMIC countries, you see some initial work on drug discovery. There's a lot of work on infection forecasting in the ICUs. There's a little more work on public health response to infectious diseases in LMICs. Now, but one major thing that is essentially changing is all the previous applications that I talked about, they were largely unimodal, whereas now the world is moving more towards multimodal, and especially even in healthcare, you certainly, as physicians, you don't really make diagnosis using one set of data, right? It's a much more complex way where you use both structured and unstructured data. And that's the reason why now there's a lot more movement, both in research as well as in implementation, thinking about these multimodal AI applications. But are really health systems ready to implement these AI applications? Now, I work in the space of research in the US. Now, just look at the US healthcare systems, and I want you to focus on number 16, the Stanford healthcare system, which is essentially, I'm kind of picking on Stanford primarily because with the kind of innovative ecosystem that exists in the Stanford University, the readiness of the healthcare system is just at about 12%. Nigam Shah, who is my good friend, would, of course, be unhappy that I'm projecting on Stanford, but this is the scenario of large academic healthcare systems in the US. And I'm certainly not talking about the readiness state in LMIC setup. So essentially what we see is in the, where essentially do we see healthcare AI, if you look into this axis of low risk and value, you would typically see the focus on slightly a lower risk, but a moderate value. And that is essentially where you would see most of them. One is analyzing medical images, and a lot more support on EMR embedded clinical decision support systems, automated generation of clinical notes, because essentially you want the physician not to get burdened by documentation. So you have a lot of ambient AI tools which are being implemented. But you're certainly not there at that quadrant where you have these fully autonomous robotic surgeries. That's not what we're really seeing in terms of evidence. Now, what is also very interesting for LMIC countries, and more specifically in this region where I work, is the lack of evidence that you have. Now, this study in Lancet essentially shows in our region, which is the Southeast Asia, there's just one country with one clinical trial on AI. So there's certainly evidence of AI application both in the clinical setting as well as in population level, is fairly limited in our setup. And that is essentially the major focus, especially on generating evidence in LMIC countries. Now, what do you therefore do as call for action in healthcare? Now, the private sector is essentially moving at a pace which is far too difficult for governments to catch up, and there is a potential harmful outcomes. And so what is therefore the only way forward is AI governance. So we had this Governing AI for Humanity as a major document from the US Secretary General. We've now had different countries around the world all trying to recognize this gap. And then you had, of course, the US President's executive order is now annulled. Of course, I should have had a big X to it. But the EU's AI Act, which is now going to get implemented, there is a lot of national implementation, which is yet not come into force. But the South Korea's AI Basic Act is now going to hit in 2026. So essentially, governments are making the first steps globally, and we have different states in the United States also coming up with various legislations on AI. But what we also see is, if you look into just the US alone, there are about 100 odd legislations across various states in the US. And now, if you look into the regulatory landscape in Southeast Asia and Asia Pacific as a region, you would typically see three types of approaches: a soft approach, a medium approach, and a hard approach. And certainly, you see that there is a little more emphasis on the soft approach. And I'm sure the next speakers are going to talk a little more about the regulatory landscape and what is the soft approach and what is the hard approach. So clearly, regulating AI is the need of the hour, and there is enough that different countries have been attempting in the global north, and there is a certain gap in the global south. So what I want to do is, how ready are governments essentially? And this was, of course, targeted at my government friends, and I, of course, work in the government too. And so this is a study from Oxford Insights, which kind of try to get these 193 countries, rank them across 39 indicators, across 3 pillars. And what it really stands out is we don't have a single country in the Southeast Asia ranking in the top 25s. So essentially, it is Thailand and India and Indonesia in the top 50s, but most of our other countries are languishing fairly behind. Now, and if you deep dive into it, maybe in terms of the government reforms, in terms of strategy documents, policies, we're still making some inroads, but it's in the technology and the data infrastructure where we see large number of gaps. Now, even on the Global Index on Responsible AI, which is against on 19 thematic areas, what you would see is the violet colors are essentially the global north, where it is the Americas, Europe, and Australia, which are probably much higher on the Global Responsible AI Index, but the ones which are languishing behind, as you would expect, is Africa, the Latin America, and India, and the Southeast Asia. So certainly there is so much more that we need to do on responsible AI. So what is therefore WHO's support to member countries? We've essentially been supporting countries through this global effort on bringing together the technical leaders from ITU, from WIPO, and WHO have essentially come together. We've had this AI for Health focus group way back in 2018. And since then, the global initiative on AI for Health has been kickstarted. It's a major effort, which is essentially has 3 arms. One is to enable, wherein as an intergovernmental organization, we come up with standards, governance, policies, and guidance on evidence-based AI for health. We also facilitate some investments and then also pool global community of experts. We also help governments in implementing sustainable models of AI ecosystem at the country level. Now, we've also had this strategic roundtable on AI at the last year's Global World Health Assembly, where we had partners across different areas participating in this. We certainly, these are all the variety of guidance documents that have come from WHO on AI. There are around various areas. One thing which has really been extremely successful widely globally is the ethics and governance of AI for health, focused on the large multimodal applications. So this has been one of the most widely downloaded study. But there are a variety of thematic areas where WHO has been coming up with with guidance documents. We certainly are not doing it alone, and that's essentially the call. As AI, especially the private sector, the big tech firms, invest, the only way for the world to come together to kind of put this effort to bring AI for everyone is to collaborate. So we certainly have this global initiative bringing together some of the bright academicians, researchers, nonprofits, all coming together to collaborate with us. And then the goal is therefore to build sustainable models of AI, both at the country level, at the subnational level, and help execute large-scale deployment. We have identified a variety of strategic areas in which we work with this global community. And one thing which I want to highlight here is essentially on the part of localization and customization. We recognize the need for tailoring AI models to local contexts, and that is something which we would be giving a highest emphasis. Now, these 3, of course, are the key priority actions at WHO. One is guidance governance, second is benchmarking, and third is localization. We, of course, are partnering for success, and these are typically through the WHO collaborating centers. We have a community of practice for AI, which has now grown to about 1,500 researchers around the world. Now, one way we call for action is we essentially have a community of practice which typically presents innovations globally, and then that kind of generates where are really the evidence. Then we have a technical advisory group which kind of considers these various thematic areas, and based on that, we make a decision whether we need to have a technical brief or a policy brief or an academic course. And if we believe that there is a topic in which there is a global guidance that is needed, that's when we come up with a global guidance. And we also have an academic course on important issues such as ethics and governance on AI. These are all are freely accessible courses that the WHO runs. Now, what I want to do is, I know the next decade is going to be an extremely important area, and with the burgeoning of large language models around the world, what is going to be therefore very important is to learn how to ask a good question. I think essentially as large language models and large action models come in, I think what we really need to build as capacities is how do we ask a good question, and how do we really ensure that AI models are evidence-based and are truly scalable. So I want to leave that for you all. And essentially, as we build in, we want AI for people and AI for everyone around. Thank you for your attention, and thank you so much for having me. Thank you.
Thank you, Dr. Karthik. That was a very insightful presentation. And to bring in the industry perspective, may I call upon Mr. Andrew Wilshire to speak about empowering healthcare resilience through cloud solutions. Andrew has 38 years of experience in healthcare and currently leads healthcare public policy for AWS in the APAC region. He previously directed health economics, market access, and government relations at Medtronics for Australia and New Zealand. Starting as a registered nurse, he's held various leadership roles in the medtech and pharmaceutical sectors. Andrew holds an MBA from the University of New England and a BA in media from Griffith University. He serves on the boards of ARCS and has held directorships with Medical Technology Association of Australia. Over to you.
So thank you very much. It's I think just thanks very much. So yes, as mentioned, my name's Andrew Wiltshire. I lead the healthcare policy team for Amazon Web Services in Asia Pacific. And a lot of people ask the question, and I've had it while I've been here already, is what does AWS have to do with healthcare? So we're a hyperscale cloud services provider, and at its most basic level, we provide data storage and compute services, including AI, to customers who build healthcare and life sciences solutions. But overlaying that basic services of compute and storage, we have a range of health-specific services like FHIR-enabled health data lakes and specialized services, including health imaging, genomics, and health-specific language processing, which our customers use to build solutions for healthcare. Health data and digital health solutions are now enabling health in all aspects, everything from national public health platforms like Kawin in India for vaccine tracking, eSanjeevani here in India, to government healthcare cloud in Singapore, statewide single patient record for New South Wales Health in Australia, NHS UK and UK Biobank. So cloud and digital health are being used by some of the biggest healthcare organizations in the world, both government and private sector. So many of the major pharmaceutical and medtech companies and research organizations are utilizing cloud to support both their research and development, but also their operational activities. And despite being so open to innovation in other ways, healthcare has been very slow to adopt digital and cloud. And there's a range of reasons for that. And I would like to refer you to a very nice paper we worked with Access Health on that examines barriers to cloud adoption in Asia Pacific with country-specific comments. And look that up and have a look at some of those reasons. But there are a couple of key ones. And people who have been, and I guess two of those are a lack of clear guidance from governments and healthcare institutions to those who want to adopt cloud on the ways to do that safely and compliantly. And the other one is concern around security and resilience. And so those who are, and those of us who've worked in healthcare environments will understand, and some of these images might be quite familiar to many of you. is that we've actually done a terrible job of security and privacy and healthcare resilience around healthcare data in the past, and still do in many ways. There is, getting ahead of myself. So there is, you know, a feeling, I think, and there's a misapprehension that, you know, if you can see your server, that it must be secure. But actually, that's not the case. On-premise data management requires that, you know, significant investment and skill sets that are continuously available to ensure that the hardware and software is properly maintained and current, and there's ability to back up and recover. Cloud computing can offer you standardized approaches to building resilient healthcare systems that enable innovation, but also cost-effective scaling. And it's really important that you don't put all your eggs in one basket. Single sites and modes of data storage and sharing are vulnerable to all kinds of hazards. The cloud infrastructure that we provide and that cloud hyperscalers provide, with multiple regions and availability zones, each one of them with redundant services, are critical to ensuring that health systems are able to withstand a range of you know, challenges, and they can be anything from you know, undersea cables being cut. They can be you know, damages to data centers, earthquakes, and you know, natural disasters of all kinds, but also, you know, other security issues as well, including obviously you know, malicious attacks on data systems. So cloud can provide you a range of tools to help you secure your resources. So things like identity and access management tools that allow you to really clearly and in a granular way control who has access to data and what types of data, giving you access to groups in multiple different ways, and also be able to track and audit who has been accessing data, and many other you know, tools like multi-factor authentication and so on. But it also means that by using these cloud services, they come with built-in compliance with a whole range of standards, both general security and compliance and privacy standards like GDPR, but also healthcare specific standards like HIPAA in the US and HITRUST in the US that are built into many of these services that you can kind of use passively but by adopting those services. And your system availability is of course critical. Even minor disruptions in healthcare technology systems and data availability can seriously affect patient care. It's why it's crucial to have high levels of availability and clear plans in place to be able to restore normal operations. In many cases, that ability to share information in real time is you know, really critical. And the redundant architecture that's provided through cloud systems can provide very high rate of availability. We always aim for 99.9% plus availability for systems. And that's a shared responsibility. They are a shared responsibility between the cloud service provider and you know, the customers. So AWS, and it's our job number one, is to manage the security and resilience of the cloud, but it's obviously responsibility of the users to manage the security and resilience in the cloud. But you're not on your own with that. There is a range of tools that we can provide to help you with that, everything from what we call the well-architected framework, which is a tools that you can use to build your systems in a resilient and secure way, but also both free and paid technical services around our ProServe, which can come and provide services to you, but just account teams as well. And as a way of training services as well. So there's a range of you know, training programs that you can access for free, as well as paid and more comprehensive programs that you can access as well. So a few quick policy recommendations. First of all, based on, the improvements in both efficiency, but also in resilience and security that you can get from moving through some of the traditional ways that we have secured data in healthcare to cloud, but also the cost savings and flexibility you can get through cloud. Instituting a cloud-first policy for public institutions and then encouraging private sector institutions as well to move to cloud is a really critical step. Establish resilience standards and use clear guidelines and requirements for healthcare organizations and help them understand how to do that securely and in a resilient way. Make sure that there's regulatory flexibility. Talking about regulation of AI and regulation in general, it's important to make sure that whilst regulation is important and that it's important that we look at, meeting certain standards, that we do use those international standards and don't create bespoke regulatory systems that make it very hard for people to use off-the-shelf systems or international systems. Promoting resilience testing and making sure that those validation exercises occur regularly. And it's important, very important, to foster collaboration, facilitate knowledge sharing between organisations and providers and policymakers to improve those really resilient standards. And on a broader point, the real power of accessing digital health solutions comes from really strong policy underpinnings that promote and execute coordinated and joined up national health systems and systems-wide digital health strategies. India, for example, has a fantastic strategy with the ABDM Digital Health Mission. The challenge, of course, is that it all has to be executed by states, and states are at so many different levels. But it is critical that you start to link that data together and build that infrastructure, and that the policy settings and regulatory settings are flexible enough to incorporate things like AI. Two final things. This is the report I mentioned before that we did with Access Health International Barriers for Cloud Adoption, and it has country-specific sections, including for India and many other countries around the Asia-Pacific region. And then just a quick teaser for a report that we're about to publish coming up, hopefully next month, towards responsible health AI in Asia-Pacific as well. So I'll leave you with those, and thank you very much.
Thank you to both our speakers on that insightful presentation. We now move on to the next part of the session where we have the panel discussion. It's on global perspectives on AI in healthcare, dealing with governance, ethics, and impact. I'm pleased to acknowledge that this session is being co-hosted by AHIN, a valued knowledge partner. AHIN's expertise in digital health across Asia has been instrumental in shaping the discussion today, and we're deeply grateful to their collaboration. To steer this discussion further, may I call upon Dr. Sorry, I keep calling you Dr. Jay, but yeah, Mr. Ganesh Uday Sankaran. Jay is the Executive Director of AHIN, with over 20 years of experience in digital health solutions, including hospital information systems, PACS, telemedicine, chronic disease management. He serves on boards like the Global Digital Health Network and the eHealth Expert Committee for the Global South eHealth Observatory, and is involved with the International Standards Organization on Telehealth Standards and the Bureau of Indian Standards. As an adjunct faculty member at Manipal Academy of Higher Education, he has led national health information systems workshops and authored numerous publications on digital health frameworks. He'll be guiding us through the conversations today, introducing our distinguished panelists. Over to you.
Thank you, Supriya, for the introduction. And then also, I would like to take this opportunity to quickly thank Dr. Reddy, Umaji, and the rest of the Access team, Access Health International team. And this is our second year of collaboration. It started something simple last year in Singapore, and then I'm glad that it has scaled up to a full-fledged session where Ian is able to also bring our partners from across the region. And for this session, we have speakers both on site, 2 of them here, and then 4 of them virtual. So I would like to introduce, but before that, I think I will also take this opportunity to quickly mention a few words about our network. Maybe we can have the slides on AHIN. So AHIN is a peer learning network. So we are all volunteers, and then primarily we focus on the 2 WHO regions of Southeast Asia and Western Pacific, but then we do have members from over, next slide, please. We do have members from 84 countries, 2,400 members from across 84 countries. So we do have members from other regions as well. And then as you can see that our primary offerings, like of course we were created in 2011, and then like of course like it started with 6 countries and a few members, and then now it has grown. And then as I said, like our core competence is capacity building and training, and then of course working closely with the governments. Primarily, the ministries of health or any other ministry that are relevant for digital development in the country and involved with the digital health programs. And we do support countries based on actual needs on their national digital health programs. And as you can see that we have conducted and we are conducting webinars on specialized topics. These are all free for everyone to attend. And we also have various training programs, either it is on standards, interoperability, governance frameworks related to health and digital, of course. And then also enterprise architecture, methodologies, and then those are the things that typically project management or program management, those are the trainings that we also provide. And again, all these are actually provided free of cost to the members, and thanks to the support from the partners. We also have annual events, which we call it as a general meeting. And this year we are still working out the dates, but it will be on the digital public infrastructure as applicable to health sector. The next slide, please. So in general, because we have this decade plus experience of working with countries, we primarily feel most of the issues that we face can be categorized broadly into these 4, which we call mind the gaps and fill the gaps. We actually work with the countries to help them identify those gaps in terms of governance, architecture, program management, which also includes people, the health ICT workforce or digital health or e-health workforce, whatever we call, and then the standards and interoperability broadly. And then we also use this particular framework while we work with the countries on something known as a convergence workshop. Next slide, please. The convergence workshop, because most of the countries now do have a national digital health strategy or a blueprint. But the issue is not every in PDF or paper, countries do have problems in implementing it. That's where we come in again. Broadly, 2 situations. Either the country has a national digital health strategy or a blueprint with a costed roadmap, or it doesn't have. If it doesn't have, again, we use this convergence methodology, working with the government and then bringing all the key players, both the ministries of health, digital development and communication, or IT, planning and finance. These are all core ministries which are typically involved, even the Ministry of Education to that extent, because capacity building also comes into that. And then we work with the countries to identify the priorities and then get all the stakeholders together, both within the countries, including academy, researchers, development partners, because some of the development aid comes from outside the country. We get everybody together to get them see a national big picture and the national vision for digital in health programs and help them resource it and implement it, because that is important, not just to do a workshop and coming up with a set of recommendations. So just to show you the number of workshops that we have done, and it has also taken multiple iterations. Convergence means actually to bring down the level of, I would say, the divergence, because each one wants to do something on their own. What we try to do is to bring down the level of divergence. It's like, you can imagine like a concentric circle. First, we work with the Ministry of Health and then bring all the units within the Ministry of Health on the same page, and then also bring in other partners, other ministries. And then we actually work with them for the realizing the national digital vision And if they do not have resources, again, we work with the partners to get them to commit. And we, at the end of the workshop, we also come up with a joint statement involving all the partners, that who commits to what. Not everyone will probably commit for the financial support, but some actually do. And then some others in terms of other kinds like capacity building and other support in kind. Yeah. So with that, I will end. And digital health is all about partnerships, and everyone has a specific core competence. So it is in our best interest, rather than having this fragmented approach, to work together and then achieve this. So that I can see that, the Access team has also brought a lot of partners, and many other speakers also mentioned the importance of collaboration and partnership. That's what AHIN is about. With that, I will conclude. And then I also take this opportunity to, as I said, that we have 2 speakers on site. I will invite them first, and then also we have, I think our online participants are also already joined. I will quickly introduce. And yeah, this panel is consists of leading speakers, as I said, from multiple regions and multiple countries and multiple time zones. And they will cover, the key objectives are examine the current regulatory landscape in digital health and AI, highlight the health data governance frameworks, discuss strategies for building trust in digital health, which is important for AI, explore responsible AI adoption in healthcare, and facilitate multi-stakeholder dialogue on these critical issues. We all know about the issues, but it's also good to actually use this conversation to gear towards the possible solutions. I will introduce the panelists on site first. Dr. Ada Karazanova, please come onto the stage while I introduce you. Dr. Ada is an economic affairs officer at UNSCAP, bringing over 10 years of experience in digital health and digital and health linkages. She has been a member for Global Learning Collaborative for Health Systems Research Technical Advisory Group, focusing on leveraging ICT and digital technologies for disaster risk reduction and regional integration in Asia Pacific. And she facilitates Asia and Pacific Information Superhighway APIS initiative to enhance connectivity and digital resilience. Her work includes producing analytical products, designing technical cooperation products, and supporting platforms that promote sustainable development goals. And we have much more. I will clip it at that. I will also introduce Supriya Prabhakar. Supriya Prabhakar is a digital health informatics professional with 20 years of experience in developing and implementing technology solutions for healthcare. As a technical lead at Access Health International, she leads digital health initiatives, fosters partnerships across government, private, public sector, advises startups through a social entrepreneurship accelerator, and drives capacity building efforts. And she has worked both in the LMICs and high-income countries. And then she's a medical electronics engineer with masters in international health management from Imperial College London and masters in health informatics from the University of San Francisco. And then she has also been part of the erstwhile WHO digital health in roster of experts. And now I take this opportunity to also introduce the virtual speakers who have been waiting for quite a while now. And then the first one to join is Kirsten. These are all joining virtually with us. Kirsten Mathisen from Transform Health Coalition. Kirsten has over 20 years of experience in global health policy, advocacy, equity, and gender. She is the Deputy Director and Policy Lead at Transform Health, and she enhances the digital transformation of health systems for universal health coverage. And she has previously been the Global Head of Policy and Advocacy at Save the Children International. And then she was also the Vice Chair of Gavi CSO Steering Committee, and then UK Action for Global Health Network Steering Committee, and then, of course, with the UN Food and Agriculture Organization and UNDP Kenya. And we have Dr. Piling Yap. Piling Yap is from Health AI. And Dr. Piling Yap is a pharmacist and infectious diseases epidemiologist with 15 years in global and public health. As chief scientist at Health AI, she develops training for regulators and policymakers to enhance AI regulation in health using responsible AI standards. And she also leads the Health AI's community of practice for fostering collaboration among stakeholders on regulatory mechanisms. And then, previously she was with IDARE and then worked with global initiatives on pandemic preparedness and antimicrobial resistance. And then we have Mr. Stephen Wani joining us from Kenya. And Stephen is a biomedical and health informatics professional with over 25 years of experience in digital health. He has supported over 20 African ministries of health in developing digital health policies. As a founder of Intellisoft Consulting Limited in Nairobi since 2007, he leads teams in implementing digital health solutions. And he is also the founder secretary general of Kenya Health Informatics Association and the current president of Health Informatics in Africa. He has worked with a number of global UN agencies like WHO. And currently he's pursuing his PhD in information science. And then, of course, he works with on AI in clinical decision support and then advocates for smart guidelines from the WHO. And the last virtual speaker is from AHIN, and she is Miss Jocelyn. Jocelyn is, again, a pharmacist and researcher at the Institute of for Clinical Research, National Institute of Health, Ministry of Health, Malaysia, and with 8 years of experience as a project manager for Enhanced Primary Care Program. She focuses on managing diabetes, hypertension, hyperlipidemia in Malaysia. She has also conducted data analysis training workshops within the Ministry of Health, and she holds a Master of Science in Data Science for Healthcare and Clinical Informatics from Mahidol University, and she has joined the Malaysia Secretariat of AHIN since last year and works on health data governance initiatives in the region. And she is also having a research career. And with this, we will begin the panel. And to begin with, I will take this opportunity to invite Supriya Prabhakar to also set the quick context for the panel discussion. Over to you, Supriya. Thank you.
Hi, thank you, Mr. Jay. Good afternoon again, everybody. It's an honor to address an August audience on a topic that sits on the intersection of technological innovation and patient care. To be precise, we stand at an intersection where innovation meets well-being, algorithms intersect with ethics, where policy must translate into practical implementation. So as part of the digital health component of the GLC, we've been studying the landscape of regulatory frameworks and health data governance. The last year's conclave outcomes have extended into the following findings and diving deeper into the implementation challenges. So the rapid advancement of artificial intelligence in healthcare presents us with extraordinary opportunities, but also it also presents significant governance challenges that need thoughtful navigation. Over the next few minutes, I hope to offer perspectives on creating effective pathways from policy aspirations to practical implementation. So let's first understand the complex regulatory environment that we are operating in. The healthcare AI ecosystem operates within regulations that both encourage innovation and protect patients. Effective governance isn't just about creating policies. It's about translating these actions into practices. The challenges that this challenge is compounded by healthcare's responsibility to prioritize patient safety while advancing technology. The trust remains our most valuable currency. Without transparent governance, ensuring accountability and ethical data use, even sophisticated AI systems will face resistance. So these principles lead us to several specific challenges that healthcare organizations face today. So we face three critical challenges. First, the data privacy paradox. AI needs diverse data, yet privacy limits data use. Healthcare AI must navigate regulations from GDPR to HIPAA while accessing sufficient data. Second, algorithmic accountability. Healthcare demands explainability. AI tools must be transparent, unbiased to ensure equitable treatment and maintain clinical trust. Third, the global regulatory disparities. Despite WHO establishing principles adopted by 42 countries, only 37% have enforceable AI governance mechanisms, creating potential safety risks for access across borders. So let's examine how these challenges are being addressed through various global initiatives. The regulatory landscape varies significantly, from China's rigorous clinical validation requirements to the FDA's pre-certification program that has approved 37 AI medical technologies. Regional innovations like the EU AI Act and Africa's AI4D initiative demonstrates different approaches, while cross-continental efforts like the ITU WHO focus group has validated benchmarks for evaluating AI against human clinician performance. Technical innovations are responding to these challenges. Federated learning adoption has surged by 67% since 2021, enabling privacy-preserving AI training without centralizing sensitive patient data. With this understanding of the global landscape, how do we move forward from policy to practical implementation? To bridge the policy practice divide, organizations need clear implementation guidelines that translate complex requirements into practical steps. Comprehensive stakeholder training ensuring all participants understand their compliance roles. Structured feedback mechanism to gather real-world implementation data for future policy development. Continuous improvement processes for regular review as technology evolves. The emerging practice of federated learning illustrates how innovation can address privacy concerns while maintaining analytical utility. So this implementation cannot happen in silos. Effective governance, it requires coordinated effort across various sectors. No single entity can navigate this landscape alone. Effective governance requires public-private partnerships, pooling expertise from government, healthcare providers, and technology companies. Global alliances working towards harmonized frameworks across nations, academic research, evaluating governance approach, and proposing evidence-based improvements. Finally, patient advocacy, ensuring that those affected have a voice in the governance decisions. The foundation for these efforts is robust data governance, from FHIR standards to differential than 0.01%. How can governance frameworks evolve alongside advancing AI while maintaining ethical standards? So there are a few questions that we'd like the panel to take up, and we would invite perspective from the varied distinguished speakers that we have today. A few of the questions that we'd like them to speak about would be, what strategies ensure equitable access across regions with varying resources? How might we prevent a widening digital divide in the AI-enabled healthcare? How can we foster long-term public trust through transparent governance? And what specific transparency mechanisms have proven most effective in their particular experiences? So I would look forward to hearing from our panelists on their perspective on these critical questions. Thank you.
So I think the first question I would like to pose, like we have tried to segment this panel discussion, and this particular segment will focus on governance and ethics. And then I would like to ask this question to Stephen from Helena. Stephen, I hope you're online right now. So what do you consider the most critical ethical challenge that AI governance in healthcare must address immediately? And also, please give some reasoning for the urgency involved. Over to you, Stephen.
Thanks, Jai, and please let me know if you can hear me clearly.
Yes.
Thank you. So my name is Stephen Onya. As Jai introduced me, I'm really happy to be here, and thank you very much for the invitation. I represent Helena, which is a 30-year-old organization. EHIN that Jai represents is our sister organization. So we're also a network organization supporting the digital health and health informatics across Africa, and we've got membership just like EHIN across our countries in Africa. So just to answer you the question directly, Jay, I think I would look at this from the three perspectives of AI governance. Both in, like the 3 years of AI governance, so in terms of security, sovereignty, and sensitivity. So I think in terms of security, I would say that one of the biggest ethical challenges, and this is also referring to what's going on in Africa, I think has to do with cybersecurity threats. I think, foundationally, I think as we know, the investments, especially if you're in the securities space, particularly in the health sector, the investments in cybersecurity are very, very low. And I think if you understand how AI works technologically, the threats are really highly elevated. And so I would say from a security perspective, in terms of governance, I would look at that as one of the, I would say, increasing threats. And that's been acknowledged a couple of times by our friends and colleagues in cybersecurity. And they're saying that, Africa particularly is really not well positioned and also ready for handling that. And with AI, the threats are even bigger. And we've actually seen a couple of areas where this has been used to breach and get into highly sensitive data. In terms of sovereignty, I think ownership is probably the biggest one. We're seeing a lot of countries developing data protection acts, AI-related acts and legislations and policies, in an effort to, I think, control aspects around ownership. I think with AI and the complexity of AI, and gets even more complicated and complex when you get into Gen AI, where the center of knowledge generation is moving away from human beings, then the concept and the notion of ownership is becoming even a lot more complicated. And I think we see that also naturally starting to affect and influence things like what is the true knowledge, representativeness, issues around bias and discrimination, because then you can't even ascertain the true source of knowledge, whether it's formal official knowledge or just kind of like citizen-generated knowledge. And then I think, Jai, I would say the last piece is sensitivity. This is really around, and I think this is probably the biggest one, particularly in Africa, where there's underrepresentation in terms of ethically and culturally appropriate AI use. When you look at this from I think one of the speakers mentioned about generation and development of AI interventions that includes people, human-centered design, but also I think the data that represents people and populations that then gets used to train models. I think the ethical and cultural sensitivity of those data, the people involved in creating these algorithms, the algorithmic accountability that just been spoken about by the previous speaker. I think, Jay, I would say those are the three perspectives within which I would look at the ethical challenges we're grappling with, particularly in Africa. Thank you.
Thank you, Chris. Thank you, Stephen. I think really helpful those Chris points, especially as we are a bit behind in time. Now we will move to the second segment that involves data governance and innovation. And here we have two of the speakers. And then first question I'll pose to Dr. Peeling Yap. Peeling, I know that there is also a meeting waiting right after this, so I will go over to you first. She's from Health AI, as I introduced. How can we ensure that AI systems in healthcare are transparent and explainable? And you work with Health AI, the global regulatory body for responsible AI in healthcare. Over to you, Peeling.
Thanks a lot, Jai. And also thank you very much to the conference organizers for this kind invitation. It's my pleasure to be here. So with regards to your question, Jai, I will start off with the definitions, as I think they help us to set the context. So what do we mean when we say we want AI systems in health to be transparent and explainable? So instead of being a black box, which is often the analogy that people use to describe AI systems, transparency and explainability actually helps to provide a window into the inner workings of the AI system. So through very transparent and clear reporting of a few indicators, such as one, the properties of the data sets, such as the collection methods, the way you process and label the data. Second, the limitations and biases of the data sets. used to train the AI systems. Third, the clinical association processes and logic of the AI system that lead to the output. And oftentimes here we see AI generating recommendations, predictions, content, decisions. And fourth, the intended and scope of use for the AI system. If we get transparency around these indicators, we can actually foster understanding of how and why the AI system is working the way it is. And this is actually extremely important. So really going back to answering your question, this is extremely important for many stakeholders. So government regulators actually rely on this transparent documentation to conduct examination and validation to ensure that the AI system is safe and effective. Civil society having this information on hand can then be consulted also more meaningfully by experts like us on how the AI system is designed and how it should be used. Healthcare professionals and patients can be more mindful and aware of their interactions with the AI system. Just now, Dr. Kate actually talked about, being able to ask good questions in the future, right? When we interact with the AI systems, I think it's also equally critical to be able to review the answers and the outputs that AI gives to us. And by having the transparency into the inner workings of the AI system, I think we are able to then more critically review the outputs as well. And finally, for those adversely affected by the AI system, they can actually use the information to challenge its output during an audit process. I wanted to also share a bit more at Health AI. We actually interact a lot with health regulators when it comes to developing AI governance frameworks within countries. And we oftentimes hear that a lot of the current guidelines and principles and standards, like for example, transparency and explainability, they sound really nice on paper, but a lot of regulators are actually finding it very challenging, particularly those ones from low middle income settings, to operationalize these principles into actual regulatory workflows. So what we do is we try to provide them with capacity strengthening opportunities to increase the regulators' foundational knowledge on AI and its applications in health, but also to be kept up to date with the evolving global and regional AI governance landscape. Furthermore, we also provide very bespoke technical assistance on both technical and clinical validation methodologies, as well as blueprints for regulatory sandboxes, cybersecurity, and data governance. This is really to enhance the regulators' capabilities to establish context-specific AI regulations for health and workflow so that they can ensure the safety and effectiveness of these systems. In fact, actually, we recently just launched an expression of interest for countries and their regulatory authorities to join our global regulatory network so as to assess the training, which I have mentioned just now. So please feel free for the governments within this conference to check it out on our website, healthai.agency/GRN. Thank you very much, Jai.
Thank you, Pei-Ling. I think that's what you mentioned about the support to the countries is also very important. And then as we have been discussing how we can collaborate with AHIN. And then I'll be happy, if anyone is interested to know what Pei-Ling is mentioning, I could also share those links. You could look up the two-pager that they have come up with and how pioneering countries can be selected and then the process that they can walk you through. Thank you. Now we have the second speaker in this segment. And that is Dr. Ada. Dr. Ada, how can we strengthen policies and regulatory frameworks for digital public services to support AI-driven health systems? Over to you. Yeah, please.
Thank you very much. I was actually very excited to prepare for this session and to arrive after 1 year. Can you connect my computer? Because I have a few slides that I would like to help me to visualize the storyline. So, because not everyone good with listening, right? Some of us like more visualization. So they will just help me to deliver the message across. I have three main points. One is mandates. So I will have three parts of three points. Mandates of ESCAP. So what happened within last year since we've been to Singapore at annual Conclave. And I would like to focus on open data frameworks and also on future pacing through the foresight for the digital foresight. I have a slide deck. Can it be shown? Okay. I understand why this question emerged, importance of regulations and AI, and we have to look at the future and emerging future, or the pool of the future from the foresight terminology. Asia is emerging as a hub of digital transformation, and we see a lot of cognitive digital technologies as AI and GovTech, FinTech, Internet of Things, and even tax system administration, all is coming up, and interoperability, as you have highlighted, is important. And within these three messages that I mentioned to you, the value of regional collaboration is important. I'm coming from Economic and Social Commission for Asia and the Pacific, which has over 62, actually 58, 62 member states. And we serve as secretariat, and member states are driving the work of their SCAP. And the strengthening of regional cooperation was highlighted in a number of events, and the pathways have been looking at the main points of process and impacts. So innovation and digital solutions are coming hand in hand with the impact, which need to be seized in the form of regulation. So these pathways that embrace the digital innovation platforms also enhance social technical competence of regional stakeholders and promote policy convergence. In our section, I'm in the ICT for development section, so it's an interdisciplinary work. We've been looking at climate portfolio. Now we're looking at digital public services for small and medium enterprises, and digital health is, I was expecting some mandate. And I would like to thank Dr. Reddy, who joined the Asia Pacific Ministerial Conference on Digital Inclusion Transformation 2024. And he highlighted the importance of health sector to be included in the digital agenda of digital ministries. He mentioned in the side event of high-level policymakers, there were 8 policymakers, ministers. He mentioned that the digital public infrastructure is key, and that we have to make it strong, resilient, and secure, and that inclusive transformation should also support and be integral to any policies and strategies and plans. So this was quite a success, because you mentioned it once and then it will be going into different programs and projects on different levels. So thank you very much, Dr. Reddy, because we do have information superhighway that is similar to digital public infrastructure. It is for all, and it is managed by member states. And our job as secretariat to provide the platform for discussions, analytical work, and technical cooperation. So in that sense, it has 3 main aspects of infrastructure, which is on connectivity for all and e-resilience. And I've been reporting on that to this network previous years. It is about the digital technology and applications. Actually, the co-chair of this bureau, Onaikan Group 2, is from India. It's the Indian government. So you have direct access to influence the decision makers of the whole region. And also on digital data, that's why I'm coming with open data framework. And as UN, we are also reforming and changing, and Secretary General's Quintet of Change is asking the staff members to show the competence and drive the member states on foresight technologies, on data, digital innovation, and behavioral science. So this is just flashing out some pictures from ministerial attendance, which is highlighting that APIS action plan is a key for connectivity and transformation. So let's go to data sharing system. So my main message here is data sharing and actually open data framework. Yeah, Mr. Jai. So you could see from SDG framework, we are doing quite well in some towards health and well-being under SDG 3, but there are some shortcomings that you could see on this graph. And it's open, so you can look at it and then observe at national level, sub-regional level, and learn and make decisions on who you want to work with. And the challenge is coming with all this big data because there are complex interlinkages and based on systems thinking, actually. They can be explained through frameworks, health tech innovations, and interoperability of AI-driven healthcare. How can one person do it or one institution? So we need actually good computing powers to look at climate change impacts, food systems, energy systems, and ICT systems, and we can learn from that. So just to remind you, the digital transformation, actually we created a methodology where we look at digital transformation from 3-speed approach, where accelerators or the leaders, you could see they are driving the digital acceleration, and there are 5 actors like infrastructure as a default, and then government, business, people, and ecosystem. And each of them bring to the table some competence on, and then the environment. Though there are a number of countries that are at adoption level of digital transformation, where they are still looking at skills, market, and applications, and diversity and dynamism. And there are a number of countries that require foundational base, where the network availability and affordability and also macroeconomic stability is must to be ensured before we talk about transformation. So this is the data set we had, and ESCAP missed the data for Central Asia. So that's how I got in the jump in the waters and proposed actually the data set for SPECA and then its e-resilience. So it's a laborious work. I didn't have much manpower to support. So that's why I think this work should be on standby and wait for AI to come in and compute for us. So it can be openly available, but it is openly available, and our interns are working hard. So back to this new study highlights on public services or digital public services in healthcare for SMEs may want to learn from this publication. We looked at for North and Central Asia. We actually showed that we depend on data frameworks. We need monitor digital transformation dynamics. We need to ensure the e-resilience with 5 pillars as a base, and as a solution, the open data frameworks. So just to highlight again, when we talk about data and open data frameworks, the government officials actually needed our guidance, and then we look at the resilience through risk-informed interventions. And I have few examples to show you in the next few slides. So understanding systemic risks would be important. And all these interlinkages, we have done the good exercise on interlinkages between SDGs and system thinking, but now with health sector, we need to deep dive and work with professionals and generate critical data to train AI models. So these are just few examples of the initiative. As I mentioned, SDG Gateway, we have methodology of Digital Transformation Index, e-resilience dashboard, and the award-winning SAT-GPT, not ChatGPT, but SAT-GPT, space application GPT. So this SAT-GPT has been emerging as an amazing tool. Also, it's been trained, improved, and evolved. If you look at the computing power, it's also looking at Earth Engine, Google Earth Engine. It has access to 20 petabytes of Earth data, and to generate one single flood map, we need 600 lines of code, which computes from 200 to 1,000 gigabytes of data in less than a minute. So this is the interesting tool that we may want to learn from and extrapolate and use in health sector as well. So I'm just animating it. For the sake of time, I will go through to the next final concluding points about the future. As from our level, of technical level, we help member states to use future forecasting and foresight using scientific methodology of engagement. So we visualize the future. As I mentioned earlier, if we visualize Asia Pacific as a hub, then let's look at the public services in healthcare. What is the pool of future? Where do you see healthcare in the future? And then pressures of present and weight of the past would be competing forces to achieve that future. But to make sure that we're aligned with the past and relevant for the present and moving strongly to the future, we need to put scenarios. And here, since you have science background and you like to dream, you can also look at the methodology of scenario planning. So with no change, where traditions eat strategy for the breakfast, so you don't need any strategy, and maybe that's the best way. Yeah, and but there are other communities and countries that want to have incremental change or marginal change, and these are normally traditionalists or conservatives going towards reforming the present and adaptive change. And we notice that most of the Central Asian countries want to have adaptive change, and radicalists, the dreamers and revolutionists. So early knowledge is coming up from 3 workshops. I just will flash it out. All of them are looking at adaptive governance, services with AI-driven automation and unified digital platform. And that was for Kyrgyzstan, this is Uzbekistan and Kazakhstan. So 3 countries highlighted what they want, and I summarize on next 2 slides. So we looked at future of digital public services for SMEs that could be easily applied for healthcare. We have here a lot of opportunities for collaboration, like for regulators, need more streamlined and efficient interaction between the state and the business. Service providers highlighted importance of trust, transparency, envisioning symbiotic relationship where state and business entitled to work together proactively. Then SMEs themselves, they want equitable access to public services for all SMEs, supported by advanced policies. And also shared vision through inclusive dialogue and international partners that really want platforms. So for Asia Pacific countries, there are recommendations, and for UNSCAP on left and right hand side. So Asia Pacific need to prioritize services for SMEs because they are driving the economy more than 50%, right? 70% of economy is built on SMEs. Also build interoperable e-governance systems. And for ESCAP, for us, I have a task now to develop a methodology for accessing the quality and efficiency of DPS for SMEs, some kind of maturity index, and also establish an expert group for development of DPS. This is just a summary slide of what we do. You can look at it later. And for the takeaway, I just want to highlight again the Asia Pacific Information Superhighway. As Dr. Reddy said, it is a digital public infrastructure because it may provide valuable opportunities. And this is a bureau. And this bureau is responsible, it's member-driven for the action plan 2022-2026. And we will be developing a new action plan. So I welcome you to collaborate and to network and to be proactive. Thank you very much, Ms. Jai.
Thank you, Ada, for the UN's perspective, especially from ESCAP, and then also about the digital public services, and then APIS. Very helpful, and then we look forward to collaborate, of course, with you and team. And the next segment, we deal with cross-border, and then also there is a need for harmonization in terms of legislative aspects, and then also health data governance. As I say that in most of these discussions, AI is it's important to have health data governance. Without health data governance, it's very difficult to actually navigate the AI space. So we have a couple of our speakers. Since we just had the global perspective from UN, then I think we will get back to the region and then come back to the global again. So we have Jocelyn from AHIN. Jocelyn, could you please elaborate AHIN's initiatives for regional engagement on health data governance and collaboration with partners? Over to you, Jocelyn.
Yeah, I'll share my screen here. Hi, good afternoon, everyone. So I'm Jocelyn here, and I will share with you AHIN's experience with Asia regional engagement on health data governance. And I'll move very quickly through AHIN's journey with health data governance. So we have been working very closely with Transform Health since 2021 in the drafting of HDG principles, leading to the launch, and also we share it in our AHIN hours. So we also have done country consultation and regional consultations on HDG principles as well as the draft model law. So AHIN has been instrumental as well in advocating HDG in regional and global events, as well as inviting high-level stakeholders from countries to join WHA side events. So this is the HDG principles, which I think maybe Kristen will also mention later. And we have done 3 country consultations in 2023 in Malaysia, Philippines, and Sri Lanka, where we invited multiple stakeholders in each country to discuss on how they could apply HDG principles in their country. And in the end of the year, where we have our AHIN general meeting, we invited all the countries to share their country experience with the regional network. And then in early 2024, where the model law began its public consultation, we also conducted an Asia regional consultation to ask about opinions from our region, where we have virtual discussion and also offline feedback to gather as many comments as possible from the stakeholders. So we have we are able to collect data from Sri Lanka, Maldives, Thailand, Philippines, Malaysia, and Nepal. And the stakeholders all agreed that a model law focusing on HDG will be useful for the countries, especially as the existing PDPA may not specify on health data. And the adoption will actually depend on countries' maturity. Multiple stakeholders will need to review the model laws in order for them to apply, but it will also depend on country structure on who should be reviewing. Following that, we have a virtual discussion again to discuss on how to implement draft model law in November 7, which is in line with our digital health event, digital health week event. So we have delighted to have 6 speakers, including Transform Health to set the stage, MOH Sri Lanka sharing their country updates and experience, WHO Repro sharing on the newly launched regional action framework of digital health, our consultant from Helena sharing his experience implementing draft model law in 3 countries in Africa, and AHIN GC sharing on One Health experience in Indonesia. So we highlighted that it needs to adapt to local context in order to adapt the model law, which includes the culture, legislation, and healthcare system. Capacity building is also important, and also to increase public awareness. Partner collaboration is important to share technology resources, tools, expertise, and also investment. So these are the importance, and where I don't think I need to elaborate further, but I would like to also highlight about building trust. And AHIN actually help our working council members, which help us to make this happen. They help us to invite all the important stakeholders, and also for them to understand the current development in HDG. So with that, I would like to highlight that building trust in HDG is required, where consistent engagement with stakeholders to increase their awareness and about the importance of HDG. And sharing successful stories with them would be good. And also collaboration between ministries, sectors, and organizations are needed. With that, I'll end my presentation. Thank you.
Thank you. Thank you, Jocelyn. Now we will have Kirsten from Transform Health, again, sharing about the global perspective and how, because we had the regions sharing our experience of how we had the regional engagement with the countries. But then now we move back as the final speaker for the panel. Kirsten, over to you. And how do we actually facilitate cross-border data sharing while maintaining the data sovereignty? And then you could actually relate this to the importance of harmonization across countries for health data governance frameworks, and then also share insights on building consensus around core legislative areas. We have 5 minutes, Kirsten. Organizers are already indicating the out of time for me. Over to you, Kirsten.
Thank you, Jai, and thank you to the organizers for inviting me to be part of this. I will not show my slides, and I will just try to kind of go through a few key points. So as Jai mentioned earlier when he introduced me, so I work for Transform Health. And just to mention, so Transform Health, we are a coalition of organizations. We have more than 200 organizations as part of the coalition. And we're very much focused on advocating for and supporting the enabling environment for the digital health transformation, how we can really leverage digital health and data use towards UHC goals. So I'm really happy actually that earlier the introductory remarks and other speakers have already made the case for the importance of governance and particularly health data governance as we are looking at digital health and advances in AI. So I don't need to mention that. And also really the importance of and the value of global as well as regional collaboration as we look towards this. So I think as we look at cross-border data sharing and the importance of maintaining data sovereignty, I think kind of an important starting point for that is really the need for countries to be in the driver's seat and to have those robust national legislative frameworks in place to really provide those guardrails for the responsible collection and use of health data. And this would provide those rules and guardrails for all actors operating within the country that are collecting and using data. And to make sure that the countries are really guiding what is needed to protect their populations. And this is important both for kind of the use and sharing of data within, but also across borders. And particularly as, you know, we're part of this session, it's very clear all of these rapid advancements in technology, innovation is often outpacing that legislation and regulation. So again, really important that government leadership and action to really kind of get ahead of the game and to make sure that those legislative frameworks are in place and adequate to address the digital age that we're currently living in and will continue to advance. So this is really important to really be able to harness the value of that data, both as an individual and public value of it as well, but while really ensuring the right protections in place to safeguard that data and uphold rights. And then this is really essential to then build that public trust in those health data systems. And I'm happy that Jocelyn already emphasized the point of trust so that people know that their data is being handled and used responsibly. So they're also happy for their data to be used to promote public benefit from it as well, because they know the guardrails are in place to protect it. And then ultimately this improves health outcomes. But while a number of countries and regions are taking steps to address this, what we've seen is that a lot of the approaches vary and countries are at differing levels of maturity. And there's no kind of global or regional standard really of what those optimal legislative and regulatory provisions that are needed to govern health data. And this is where then the global and regional collaboration really comes in, and the value of taking a more harmonized approach and the opportunity this offers to support cross-country learning, build on national experiences, and understand where countries have gotten aspects right, where there are the challenges, to really kind of foster that country consensus and action, and ideally then lead towards a global standard. So this was ultimately help foster an enabling yet secure environment for cross-border data sharing as well. And there's lots of consensus around this. I won't go into previously some of the various strategies, et cetera, and discussions have been mentioned where there's growing consensus, including the most recently, the Global Digital Compact that was endorsed at the Summit of the Future by all governments in just last September. But how do we really kind of take that forward and ensure it's implemented? So this is why Transform Health and many of our partners, including many that have been part of today's panel, are calling for the development and endorsement of a global health data governance framework through a World Health Assembly resolution, as well as regional processes and mechanisms to really kind of build that country consensus and commitment around a global standard to help establish that level of compatibility across national approaches, which would then foster that legal coherence across jurisdictions, which would then facilitate the responsible data sharing across borders while ensuring the needed protections are in place. And that would ultimately also create a resource to support national efforts as they're strengthening their national frameworks. So as a step towards this, and Jocelyn mentioned as well during her intervention, Transform Health has been working with a number of partners, including AHIN, Helena, that was previously on the call, the Health Data Collaborative, Africa CDC, among others, to develop a model law on health data governance. you can access it on the website, healthdatagovernance.org, which essentially provides a blueprint and a flexible framework, which serves as a resource for governments, but also offers a step towards developing a global framework. And it contains core elements, guidance, reference legal texts that can be used to support kind of what is needed in terms of those legislative provisions. But in terms of that, as Jai mentioned in the question towards me around kind of what building consensus around those core areas. So in developing the model law, we've taken a very intentional, consultative, and inclusive process in developing it and in consulting around the model law. And so while the drafting was led by a legal team of experts with an expert advisory group, with review from various working groups operating within this space, and has been informed by, for example, the principles that Jocelyn mentioned earlier and other national legislative landscape reviews, we held a public consultation period on the model law to we had consultations to both inform it, but then consultations on the draft itself. So we had more than 14 regional and national consultations, bringing together diverse stakeholders, because again, while governments really need to be in the driver's seat, it's important to be engaging a diverse set of stakeholders and expertise to inform that, including those lived experiences from communities and populations. We also had a youth-specific consultation, carried out a number of expert interviews, and then through that public consultation period, we had a public survey available in 5 languages and a community forum. So really to gather, we really wanted to kind of get wide insights into it and to really kind of validate if they are the right kind of legal provisions that are needed. So that was launched last May at the World Health Assembly. And just to very briefly finish off, because I know we're getting at time, Jai, I can see the look in your face. Just to say, we have also been kind of testing that to really validate if it is the practical use of the model law as a tool to support governments. So we've been doing that in a number of countries last year, working closely with regional partners. And then we're also looking to kind of expand that moving forward. And we've had a number of requests as well of countries that would like to kind of use this approach and how that can be facilitated. And on the website I mentioned earlier, healthdatagovernance.org, we have also recently published a number of other resources that can support countries. So including the principles, the model law, an implementation guide, an assessment, a legislative assessment tool, as well as landscape reviews. Final point, just as I finish off, just to really reemphasize the importance of government leadership in really driving this forward, getting this on the agenda of the World Health Assembly to facilitate that discussion through an appropriate global mechanism such as the World Health Assembly. And I will end there. Thank you so much.
Thank you. Thank you, Kristen. And then thank you all the speakers who were, especially those who were able to join irrespective of the time zones, the regions, and making these discussions richer. Thank you very much. I think this is a beginning, and then we will have more opportunities to collaborate. And then I would be happy to share the links about model law and then the health data governance with those who are interested. And then we carry this discussion in the further rounds of collaboration. And thanks once again to Dr. Reddy and the Access Health International team for giving us these opportunities, not only to AHIN, but also to our partners here. And then over to Maji. Thank you.